so I'm going to be taking care of you. What's your name?
Kendall.
Okay, and what's the date?
It's November the 16th, 2011.
Okay, and how old are you?
I'm 20 years old.
And who's the president?
Obama.
Okay, so her general appearance so far good, posture's nice, and her gait was fine walking in. So now I'm going to go ahead and do some vital signs here. Okay, if I can see your arm, please. Alright, rest your arm down. Alright, I got 125 over 90, or 124 over 90. Alright, we're going to take your pulse. Write this down. Take your pulse here. Alright, we got a pulse of 104 and respirations of 18. And that now your speech was very well, and that is cranial nerves 10 and 12. I think I have everything. I did respirations.
Names. Temperature.
And now I'm going to do your temperature. Undo your tongue. Alright. Okay, 98.9. Okay, so please state your ethnicity, please.
I'm American.
Okay, and do you know where you are today?
I'm at Columbus Technical College.
Okay. Okay, so now we're going to assess your head. I'm going to remove your glasses so you can get a better look here. So first I'm going to start up top with your hair. We're going to check color. We're going to check the scalp and the texture and make sure everything's healthy and there's nothing abnormal going on, no lesions or bald spots, alopecia. So everything's good there. Okay, so now we're going to move down to the temporal arteries. Alright, you got a good force of 2. Okay, now we're going to move down to your sinuses. I'm going to do the maxillary. You tell me if you feel tenderness. No tenderness? Okay, and then frontal. Tell me about tenderness. Nothing? Okay, good. Alright, so now we're going to do your jaw here. And if you'll do me a favor and clench down and open your jaw. Okay, and that is your trigeminal nerve number 5. And now we're going to ask you, I'm going to ask you to smile, frown, puff your cheeks, wrinkle your forehead, raise your eyebrows, close your eyes, and open them. And that is facial nerve 7. Alright, now we're going to assess your eyes. So again, we're going to get rid of those. First we're going to start with the external structures, which is your eyebrows, eyelashes. Make sure everything's evenly distributed. I don't see any lesions, no obvious drainage, and I'll go ahead and then inspect your conjunctiva. Both of them, they're nice and bright red pink. And we're going to look at your cornea to make sure there's no scarring, no scratches or anything like that. Your sclera is very white, which is good, and your iris color's nice and even. Your pupils are both round. And I'm going to use our pen light here. We're going to look at your corneal reflex first, which is cranial nerve 5. So if you look straight ahead, and that's fine. And next we're going to do, we're going to see if your pupils react to light, so I'm going to come in from the side. Okay, and they're about between a 3 and a 4 when they're dilated. Now I'm going to do I'm going to test for your red reflex when it's on. Okay. Alright. And that's good. Okay, if I can get you to walk about 20 feet away, I've marked it for you, and get your glasses. And we're going to check your vision, which is cranial nerve 2. So if you will read the lowest sign you can.
EDFCZP.
Alright, that is 20/30 vision. Okay, now we're going to check for accommodation. So if you'll look at my finger, and now look at the wall behind me. Okay, and now we're going to do the extraocular movements, which is cranial nerves 2, 3, and 3, 4, and 6. So follow my finger with your eyes, not your head. 2, 3, 4, 5, and 6. Okay. Yeah, I did everything. And your pupils are good with PERLA, which stands for pupils are equal, round, and react to light. And they accommodate well. Okay. Now we're gonna take a look at your ears. We're gonna assess and make sure everything's okay. So of course, as always, we're gonna start externally and make sure there's no lumps and no lesions, no obvious anything that could be wrong. Okay. And now we're going to take the otoscope and we're going to look inside at your tympanic membrane. The tympanic membrane should have a light reflex at about 5 o'clock and should have a bone kind of sticking out called the malleus between 1 and 2 o'clock. Okay. Alright, so I'm going to pull the pen up back and up. Okay. And everything looks good. Alright. Now we're going to take some hearing tests, and this is going to be testing cranial nerve 8. First I'm going to start with a tuning fork, and I'm going to hit it on my hand. I'm going to put it at the top of your head. You tell me that you can tell me if you can hear it equally within both ears. Okay. All right. Now I'm going to do this. This is a bone versus air conduction test. This is the RENA test, and I'm going to hit it on. I'm going to put it on your mandibular bone, and then I'm going to put it to the air. Whenever I put it on the bone, tell me when you don't hear it anymore, and then same with whenever I put it on the outside of your ear. Okay, and air conduction should be twice as long as bone conduction. We'll go ahead and do this one. Alright. And now we're going to do the whisper voice test. And I'm going to close this ear and whisper something in this ear. You tell me that you can hear it. do this one.